Welcome back guys. Now let's continue with the topic of mechanics of breathing. So in this topic of mechanics of breathing, what and all we are going to study, we will be studying about how air enters into the lung and how air exits out of the lung. That is inspiration and expiration. Okay. See, inspiration is active process. Why I am saying it as active process? Because if you want to do the inspiration, you have to contract certain muscles. Okay, you have to contract certain muscles in order to take the air into the lungs. So if you want to contract the muscles, definitely you have to use the energy. So inspiration is active because you need to do muscle contraction. So which muscles you need to contract in order to take the inspiration? You have to contract the major inspiratory muscle called as the diaphragm. Apart from diaphragm, external intercostal, scalene muscles and sternocleidomastoid. So these muscles also helps in inspiration. The major muscle is, see, this is the major muscle. Diaphragm is the major muscle. Major inspiratory muscle, others are accessory, they are also helping. So they include not internal, okay, usually students will think inspiration, internal, external. No, inspiration, it's the external intercostal muscles. External intercostal muscles, scalene muscles and sternocleidomastoid muscles, these are the muscles which are needed for the inspiratory process. Next, sir, in order to contract diaphragm, which nerve is required? Which nerve contracts the diaphragm? That's a phrenic nerve. Phrenic nerve. Okay, phrenic nerve supplies the diaphragm, causes the contraction of the diaphragm. Done. Next, expiration. Look here. Expiration is a passive process, guys. Expiration is passive. Okay, it is passive. Why it is passive? Because no need to contract any muscle. Because of the muscle contraction, air goes into the lungs. Now, it's the relaxation of the muscle. See, relaxation of muscles is a passive process. Relaxation doesn't require any ATP. So, it's not the muscle contraction which is required, it's a muscle relaxation. So, expiration, see, there is no need of muscle contraction. Okay, no need of muscle contraction, just muscle relaxation itself is enough for the expiration to occur. But they ask about the forceful expiration. See, I am talking about the word forceful expiration. Then forceful expiration is again active. Okay, again active. Then which muscles are needed for the forceful expiration? Means when you are trying to blow some balloons or blowing candles, okay, you have to do it forcefully. So forceful expiration is active and the muscles which are required are transverse abdominis and rectus abdominis. Okay, this is the most important. Rectus abdominis is needed during forceful expiration. Okay, now after seeing what are the muscles which are required for inspiration and expiration, now let's see why air exactly enters into the lung. Okay, look at this diagram. Okay, students, here you can see, here is the trachea, bronchi and here is the lung and here is the alveolus. Everyone knows. First of all, what are these things which I am showing here in the cross section? See, these are your ribs, guys. Okay, here is the ribs. Here are the ribs. Lung anteriorly, laterally, posteriorly, they are all surrounded by this ribs. On cross section, I am showing the ribs. Now, look, on the bottom, what is this muscle which I am showing here? Here is the diaphragm. So, lung comfortably sitting on the diaphragm. On the sides, anteriorly, laterally, posteriorly, your lungs are surrounded by ribs. But on the bottom side, lungs are sitting on diaphragm. Here is a diaphragm. Okay, sir. Now tell me, lung is surrounded by a layer. What is a layer called as pleura? Okay, lungs are surrounded by pleura, we know. Now, how many types of pleura are there? Two types of pleura. One is visceral pleura, other one is parietal pleura. Look here. So, this blue color membrane, okay, blue color membrane which is attaching tightly to the lung surface, this blue color membrane, this is called as a visceral pleura. So, the pleura which attaches to the lung surface is called as a visceral pleura, everyone knows. And what is this pleura, guys? The pleura, this orange color one, it is coming and it is attaching to the surface of the ribs. Okay, it is attaching to the surface of the ribs. On the bottom side, it is attaching to the diaphragm. So, what is this pleura that I am highlighting right now? That's called as a parietal pleura. So, there is visceral pleura, parietal pleura. Visceral pleura attaches with the surface of the lungs. Parietal pleura attaches with the surface of the ribs and diaphragm on the bottom side. Okay. Now, students, look at here. In between this visceral pleura and parietal pleura, okay, in between the visceral pleura and parietal pleura, there is a space. What is the space called as? The space is called as intrapleural space. Now, let's see some pressures. Guys, what is the atmospheric pressure? Okay, normally, what is the atmospheric pressure? We all know the atmospheric pressure is somewhere around 760 mm of Hg. Now, in respiratory physiology, let's consider it as a 0. The 760 mm Hg, let's take it as a 0. Okay, that 760 mm Hg is equal to 0. So, atmospheric pressure, let's consider it as a 0. For easy understanding purpose. In physics, we will consider it as a 1. But here in the respiratory physiology, we are taking it as a 0. Fine. Now, the same atmospheric pressure through our nostrils, okay, through our nostrils and through our mouth, it's the same atmospheric pressure is communicating into our alveolus. So the same atmospheric pressure is also going into our alveolus. So what is the intra-alveolar pressure? See, P, that is pressure in the alveolus. Intra-alveolar pressure is also 0. Outside 0, inside also 0. Now, what is the pressure in the intrapleural space? See here in the intrapleural space, what is the pressure, sir? Pressure actually here, look, is minus 2.5 mm Hg. What is the pressure, guys? Minus 2.5 mm Hg. We all know negative pressure means what? Negative pressure means vacuum. Okay, 0 means no pressure, let's say. Negative pressure means what? Vacuum. Actually, it's less vacuum. Okay, there is vacuum. Now, why do we have vacuum around the lung? See, throughout the lung, all this area, there is a negative pressure. Okay, negative pressure here. Now, what is the importance of this negative pressure? See, the negative pressure is because it's trying to keep the lung open. So, right, this negative pressure, negative intrapleural pressure, it helps to keep the lung stretched from all the direction. From all the direction, the lung is being stretched and kept open. Let me give you a better understanding. Students, your lung is made up of what, sir? This entire lung material is made up of what? It is made up of a protein called as elastin and collagen. Lung is made up of what? Elastin and collagen. So this elastin and collagen always wants to undergo recoil and always they want to collapse our lung. Tell me, is it good or bad? Bad. See, it's a recoiling force, collapsing force, which is bad. Now, in order to keep the lung open, on one side there is a collapsing force. This elastin is trying to cause the elastic recoil, which is bad. So, God created vacuum around the lungs. So, around the lungs, what is there? There is vacuum. This negative pressure is there. What this negative pressure is doing? From all the directions, in all the directions, this negative pressure is keeping the lung stretch open. It is stretching the lung kept open. Because have you ever tried this? Vacuum. Wherever there is vacuum, vacuum is going to pull the things. Have you ever done this? Taking a glass, okay, an empty glass, taking it to your mouth and trying to create vacuum in it. Okay, take a glass to your mouth and suck the air out of it. When you suck the air out of it, who is developing in the glass? Vacuum will develop in the glass. Now what that vacuum will do? Vacuum is going to pull your lips. It's going to pull your lips into the glass, right? In the same way, here there is vacuum. Around the lungs, who is there? There is vacuum. And whenever there is vacuum, okay, wherever there is vacuum, what this vacuum is trying to do? Vacuum is trying to keep the lung stretched open in all the directions so that our lung is not collapsing. Now, why this is important for you? Why this is important? Because imagine that this patient is having a stab injury. Today he is having a road traffic accident or he is having a stab injury where his pleura is getting punctured in this area. Now, I am telling you this area is having a puncture. There is a stab injury or some flail chest, because of which here in this area the pleura got damaged. So what will happen? Now the atmospheric pressure, that is 0 atmospheric pressure, will enter into the pleura. So what will happen here? The atmospheric pressure will come, the intrapleural pressure also becomes 0. Now tell me, the negative pressure is there now? No, there is no negative pressure. There is no more vacuum now because air entered into the pleural space. Now there is no more vacuum. So what will happen? Whenever vacuum is not there, there is no pulling force, immediately lung will undergo collapse. So that is what I have written here. Whenever there is a damage to pleura, because of a stab injury or some other injury, the intrapleural pressure will become 0. Now whenever the intrapleural pressure is gone, that negativity gone, that vacuum gone, immediately what will happen? The lungs will immediately undergo collapse. This condition is called as tension pneumothorax. Pneumo means air enter into the thoracic cavity, especially into the intrapleural space. Okay, this is called as a tension pneumothorax. Okay, so this is what I am showing here. See, air in the pleural space, air entered into the pleural space, because of which immediately what happened? The lung got collapsed, because lung is made up of elastin fibers. Elastin fibers always want to recoil, collapsing the lung. Okay, so here in this X-ray also you can see here this is all air, guys. Okay, all this area, this is the air, and you can see the lung borders. Okay, lung is getting collapsed. So this is the tension pneumothorax. Okay, this is the tension pneumothorax because of the entry of air. Done. Next, let's see all these important points one by one. Again in your book, let's write all these important points. During resting condition. Resting condition means what? You are not doing inspiration, you are not doing expiration. Means rest, absolutely in rest, like this. What is the atmospheric pressure? Have I told you? Atmospheric pressure is going to be 0. What is the intra-alveolar pressure? Within our alveolus, what is the pressure? That's also 0. But what is the intrapleural pressure? Intrapleural pressure always negative. How much is that? Intrapleural pressure is somewhere around minus 2.5 mmHg, minus 2.5 mmHg. Okay, it's always negative. Next up, what is the transpulmonary pressure, guys? See, transpulmonary pressure is the difference. Trans means difference. The difference in intra-alveolar pressure minus intrapleural pressure. What is the difference between intra-alveolar and intrapleural pressure? Just look at this diagram. Here, this is the transpulmonary pressure. The difference between intra-alveolar and intrapleural, that is 0 minus of minus 2.5. That's it, right? 0 minus of minus 2.5. So, right, that is 0 minus of minus 2.5. Minus of minus will become plus. So, here it is plus 2.5. The transpulmonary pressure is plus 2.5. Always remember this transpulmonary pressure, whenever it is increasing, it is a distension force. Distending pressure. More the distending pressure, more the lung expansion will happen. Later we will discuss it. Okay, we will come into this topic. But tell me for now, what is the transpulmonary pressure? The transpulmonary pressure is the difference between the intra-alveolar pressure and the intrapleural pressure. That is 0 minus of minus 2.5. Minus of minus is plus. So, what is the normal transpulmonary pressure in a normal individual during rest? Plus 2.5. Plus 2.5, and it's a distending pressure. More the TPP, more distension. Okay, we'll discuss that. In this diagram also, you can see what is the atmospheric pressure? The atmospheric pressure, sir, outside 0. What is the intra-alveolar pressure? 0. But what is the intrapleural pressure? Let's say this is the intrapleural space. In the intrapleural space, what is the pressure? Minus 2.5 mmHg. So, right here, this is intrapleural pressure, minus 2.5 mmHg. Done. The difference between these two, is called as the transpulmonary pressure. How much is the difference? The difference is plus 2.5 mmHg. Done. Next, let's see now how inspiration is going to happen. Okay, how inspiration is going to occur. We all know inspiration is an active process. Okay, inspiration is an active process where we have to contract certain muscles. So, first we are contracting the diaphragm. Okay, diaphragm is undergoing contraction, diaphragm contraction. And what will happen to the chest wall? Because of the contraction of the external intercostal muscles, the chest wall is also going to undergo expansion. So, try to do the inspiration now, guys. Whenever we do the inspiration, what will happen to our diaphragm? The diaphragm, which is a dome shaped muscle, the diaphragm is going to contract down. The diaphragm is moving down. And what will happen to our rib? The ribs are going to expand out. Okay. So, now tell me, because of this contraction of the diaphragm and there is expansion of this chest wall, what will happen? Try to understand. See, let's say these are the ribs. Okay. Okay. Let's say this is the rib. Okay. This is the surface of the ribs. Okay. This is the surface of the ribs. Now, to the surface of the ribs, which pleura is attached? It is a parietal pleura which is attached. Now, imagine here is the visceral pleura towards the lung. This is the visceral pleura. And here are the ribs to which the parietal pleura is attached. Now, whenever the chest wall is expanding out, tell me, which pleura is moving away? Now, the parietal pleura, it is going to move away from the visceral pleura. During inspiration, as the chest wall is expanding and downside the diaphragm is contracting, which pleura do you think will move away? It's a parietal pleura will start to move away, because in this diagram you can very clearly see, when this chest wall is expanding, which pleura will start to move? It's a parietal pleura it will move away from the visceral pleura. Downside also, when the diaphragm is contracting, okay, when it is contracting, it is this parietal pleura which will move downwards. So, finally tell me what happens. Sir, now the parietal pleura is moving away from visceral pleura. So, what will happen to this intrapleural space? Now, the intrapleural volume or the intrapleural space increased. Okay. So, according to the Boyle's law, we all know Boyle's law. Whenever volume increases, pressure will decrease. So, never forget about this Boyle's law. First, let me write here. Boyle's law. What Boyle's law states as? Pressure is inversely proportional to volume. Okay. This is the Boyle's law. So, right now, what happened to the intrapleural volume? The intrapleural volume increased. Whenever the intrapleural volume increases, what should happen to the pressure in the intrapleural space? It should decrease. So, that's why, right, the intrapleural volume increases. So, the intrapleural pressure is going to decrease. From minus 2.5, it is decreasing to minus 6. Minus 6 is less value, right? Minus 2.5, when compared to minus 2.5, minus 6 is less value. So, the pressure is decreasing. When volume increases, pressure decreases. So, that is what I am showing you here in this diagram. Okay, during inspiration, the intrapleural pressure from minus 2.5, it is decreasing to minus 6. Now tell me, minus 6 means what? There is more negativity, more vacuum. So right now what happened? You have developed more vacuum. Okay, you have developed more vacuum here. Now tell me, whenever there is more vacuum, wherever there is less pressure, what this vacuum will do? Vacuum, I have told you, it's like a pulling force. Now this vacuum is going to stretch the alveolus open. Now this vacuum, it is stretching the alveolus open from all the directions. Okay. Now what is happening to the alveolus? Now alveolus will start to become big. The alveolus is becoming big. Okay. So now what happened to the alveolar volume? Alveolar volume increases. Now tell me, when the alveolar volume increases, what happens, guys? When the alveolar volume increases, alveolar pressure will decrease. So the alveolar pressure from 0, it is decreasing to minus 1. Okay. Now alveolar pressure also decrease minus 1. Now tell me, outside 0, outside it is 0, here it is minus 1. So air automatically go from, we all know diffusion, air will go from high pressure to low pressure. So this is how inspiration is going to occur. See, in order to get the air, outside it is 0, outside pressure is, let's say, 0. So if you want to take the air in, what you have to do? You have to create low pressure here. In the beginning, outside 0, inside 0. So there is no flow of air. But if you want to get the air into your lungs, you have to decrease the pressure over here. You have to create a low pressure area. When you create a low pressure area in your lungs, automatically air will go into the lungs. So by contracting the diaphragm and by expanding the chest wall, you are creating a low pressure in your lungs. So air automatically goes in. Now you understand? So first tell me, during inspiration, the intrapleural pressure will go from minus 2.5 to minus 6. So there is more vacuum. This vacuum is going to allow the expansion of the alveolus. Now whenever there is expansion of the alveolus, the alveolar pressure decreases. Alveolar pressure decreases. Whenever the alveolar pressure decreases, air automatically go from high pressure to low pressure. So that's it. Inspiration topic completed. Okay, this is how air enters into your lungs. But tell me, if someone asks you, what happens to intra-alveolar pressure at end of inspiration? At the end of inspiration, what will happen to your intra-alveolar pressure? What do you think? See, during inspiration, it is minus 1. During inspiration, it is minus 1. So, do you think it will be minus 1 forever? No, because new air is coming, right? New air is coming. How much time do you think this air will come? How much time do you think the air will come? See, as the new air is coming, again this minus 1 will become 0. So again this minus 1 will become 0. Till it becomes 0, air is coming. Means equilibration. Okay, because the new air is going in, again outside will be 0, inside will also becomes 0. So what happens to the intra-alveolar pressure at the end of inspiration? It will be 0. Okay, know this value. It will become 0. Done. So inspiration topic completed. Now what about the expiration? Look carefully, guys. Expiration is very simple. If you understand inspiration, expiration is easy. Now during expiration, the muscles are relaxing. Chest wall is going back to its original position. Diaphragm is going back to its original position. Everything is getting reversed. So look at here. Chest wall collapses, going back to original position. Now diaphragm is also relaxing, going back to original position. So what will happen? Now the parietal pleura is coming back. So what will happen to the intrapleural volume? The intrapleural volume is increasing or decreasing? The intrapleural volume is decreasing. The intrapleural space is decreasing. So tell me, whenever volume decreases, what will happen to the pressure? Pressure will increase. Pressure will increase. So, right, the intrapleural pressure is increasing back to minus 2.5 mm Hg. Means coming back to normal value. Okay. So, right, during expiration, from minus 6, it is coming back to original value, that is minus 2.5. So tell me, more vacuum or less vacuum? Now vacuum decreased. So now there is less vacuum. Now there is less vacuum. Whenever there is more vacuum, it will allow the expansion of the alveolus. Now the vacuum decreased. Now whenever there is less vacuum, what is happening to the alveolus? Look, that pulling force, that vacuum force is not there. So the alveolus is undergoing collapse. Okay, alveolus is undergoing collapse. Alveolus is collapsing. So now tell me, whenever the alveolus is collapsing, okay, alveolus is collapsing. Now what will happen to the pressure? The pressure will increase. Previously I taught you it will become 0. At the end of inspiration, it will become 0. So now tell me, from 0 it will become, see, whenever the alveolar volume decreases, alveolar pressure have to increase. So from 0, it will increase to plus 1. Now it is increasing to plus 1. So outside it is 0. Now you can't change the outside value. Outside it is 0. Now inside you become plus 1. So air automatically goes out. Air automatically goes out. So in order to do the expiration, what you have to do? You have to create a higher pressure here. When you create a higher pressure, air automatically goes out. When you create lower pressure, air automatically goes in. Okay, so this is how inspiration expiration occurs because of the change in the intra-alveolar volume and intra-alveolar pressure. Okay, now let me ask you a question. Guys, what happens to intra-alveolar pressure at end of expiration? At the end of expiration, what do you think the value will be? See, the air is going out, right? The air is going out. Till how much time do you think the air will go out? Continuously the air is going out? No. Till this +1 will become 0 again. Till it becomes 0 again. So, the air is going out. As you are losing the air, what will happen to the pressure? Pressure will again come back to 0. Equilibration with the environment. 0, 0 again. So, at the end of expiration, the value will be 0. At the end of inspiration, the value will be 0. So, for your better understanding, let me draw a graph for you. See guys, here I am showing a graph with x and y axis. Here is the x axis, here is the y axis. Now I am taking the 0 value here, here +1, here -1, let's say. Now on the x axis, see I am dividing the x axis into two parts, two halves. Okay, here I am dividing it into two halves. Now the first half, let's say it is inspiration and here expiration, inspiration, expiration. Tell me in the beginning, what is the intra-alveolar pressure? Okay, on y-axis I am talking about the intra-alveolar pressure. Tell me in the beginning, what is the intra-alveolar pressure? 0. But during inspiration, let's say, during inspiration, what happened to the intra-alveolar pressure? Sir, during inspiration, the intra-alveolar pressure becomes -1. So the pressure is changing like this, from 0, it is becoming -1. And at the end of inspiration, it will again come back to 0. But during expiration, what will happen? During expiration, you are creating more positive value. So the pressure will go up to +1. But at the end of expiration, the value will become again 0. So this is how it is changing. So during inspiration, the intra-alveolar pressure will be -1 and during expiration, it is +1. It is +1. Okay. It is +1, it is -1. So always in the beginning 0, ending 0. Beginnings and endings are always 0. So let me give you the summary. Guys, look at the summary. For the intra-alveolar pressure, have I taught you? The intra-alveolar pressure during rest. The intra-alveolar pressure during rest is 0. And during inspiration, -1. During expiration, +1. But at the end of inspiration and end of expiration, again 0, 0. Done. Next, what about the intrapleural pressure? Tell me, your intrapleural pressure, will it ever become 0? No. In the inspiration, during inspiration, what happens? In the beginning, -2.5. And at the end of inspiration, it becomes -6. And during expiration, from -6, it comes back to -2.5. So intrapleural pressure in a normal individual, it will never become 0. So it is only changing between -2.5 to -6, -6 to -2.5. There is no 0 value. Okay. So look at the summary here. Intrapleural pressure, how it is changing? So in the beginning of the normal inspiration, means starting, it is -2.5. And at the end of the inspiration, is it becoming 0? No, it is becoming -6. And during expiration, from -6 to back to -2.5. So this is how inspiration and expiration is happening because of the change in intra-alveolar pressures and intrapleural pressures. Okay, so with this, we have completed the topic of mechanics of breathing, and very important thing is the intrapleural pressure is always negative. It is vacuum. It is trying to stretch the lung open. It is keeping our lung open. Once if there is any damage to our pleura, the atmospheric air will go into the intrapleural space. So the intrapleural pressure will decrease. The intrapleural pressure will become 0. So immediately our lungs will collapse. Once we lose our intrapleural pressure, our lungs will collapse. This condition is called as pneumothorax. Okay. With this, the topic of mechanics of breathing is completed. Hope the video is helpful. Thank you.